Welcome to Behind the Warrior, a podcast presented by the EOD Warrior Foundation. This series will focus on resources, interviews, and topics impacting EOD warriors, their families, and the military community at large.
Hello, everyone, and welcome to Behind the Warrior podcast. I'm your host, Maria Shabla, and today we are very excited to be speaking to the founder of CareStarter, Lamarque Polvado, and the Chief Behavioral Officer of Feedback, Dean Browell. Today we'll be learning about a recent study conducted at Travis Air Force Base, which is changing the way that military families with special needs are getting access to care. Welcome to the podcast, Lamarque and Dean.
Thank you. We're glad to be here.
Yeah, I'm so happy to be here too. So I always like to start from the beginning. Can each of you tell us about your childhood? Where did you grow up? And what's your connection to the military?
I'm going to let Dean go first on that one.
Okay.
Yeah, so I grew up in Yorktown, Virginia. I'm currently in Richmond, Virginia, but I grew up in Yorktown, Virginia, which I like to joke, where the history comes from. But it actually, interestingly enough, for me, I was a NASA kid. So my dad's lifetime NASA employee. So I grew up basically just completely surrounded by the military. I mean, and they're in the peninsula of, in the eastern area of Virginia. So all of my friends, all of my best friends, I definitely have a military connection with my grandfathers. But in terms of immediate family, no. But it's basically been in a military area almost my entire life, and so all friends and family, and literally grew up around it as all my friends PCS'd in and out my whole life.
Wow, that's interesting. So what did they do with NASA?
Yes, my dad's an environmental scientist, environmental engineer. His claim to fame, his most Indiana Jones moment is he was on the team that discovered the hole in the ozone layer over Antarctica. So he did remote sensing using lasers through clouds to detect chemical composition.
Wow. I haven't heard
Which
about...
That's a whole other podcast.
I haven't heard about a hole in the ozone in so long. That's incredible. And that should be another podcast.
Yeah.
Okay, awesome. That sounds great. What about you, Lamarque?
Well, I was born in Denver and then moved to Oklahoma. My dad was a Pentecostal and still is a Pentecostal minister. And so I grew up in and around service, but in different ways than the military. And of course, we had some military connections. My grandfather served. It's been interesting, this journey that I've been on. But we really got tied back in about, I would say 12 years ago through a guy named Jim Navarro, who's a Navy SEAL, who had a son with brain cancer. So pretty much all roads in my life lead back to pediatric special care. I've spent the last little over 15 years focused on pediatric special care, understanding the challenges there and how we can help families access care along the way, not just once, but persistently over time. And Jim Navarro is the first guy that kind of helped me understand what the military and their families, active duty and their families go through. And of course, his experience as a special operator was a whole lot of deployments throughout his career. And then when he left the military, in other organizations as well. And so he was the first guy to kind of school me on that. And then in 2016, Chuck Milam, who was Assistant Secretary of Defense for Manpower Reserve, saw my TED Talk and asked me to come to the Pentagon to talk to him about kids with special needs. And the program that he introduced to me at that time was the Exceptional Family Member Program, which we'll be talking about today. But it's really interesting when you chase a problem and you really want to solve something, it's interesting the places that it takes you. And so that is how I ended up in this space. Absolutely honored to be serving military families, and we hope to serve many, many more in lots of different ways as the years go by. But it's been an honor so far. But I'm currently in Austin, Texas. It is very warm here. Summer has arrived. I think if there was any doubt this week, we definitely know summer is here. So it's great to be here, and thank you so much for the invitation.
Yeah, we're so excited to have you. And you know what, it is funny. You never know what twists life has in store for you. You probably never thought you were going to be here interviewing with the EOD community and sharing all of your information with us. So we're very grateful for that. So I wanted to see if you guys could kind of give us a background of each of your careers and kind of what led you to be here right now at this moment.
Dean, I'm
Oh,
gonna,
wow. Yeah.
I'm
Guess
just gonna
I'll
let you
dive
go
in.
first. I'm gonna let you
Yeah. So I'll say much of my career really was spent in higher education, where I thought I was going to spend the rest of my life, and so worked on a PhD specifically looking at how different generations connect, how they connect online, how they need to listen to one another more. And I thought I would be helping colleges understand who they were trying to attract and retain, whether that's employees, whether that's students. But in that mix, I got a little frustrated because while I fell in love with ethnography and the idea of listening and watching people behave, I got really frustrated because I kept finding more and more people were online, and I couldn't necessarily see what they were doing online, even if I was trying to observe them in their natural habitats. So, developed a technique around basically applying behavioral science, doing that same ethnographic deep dive, that sort of real respectful academic analysis from like an anthropological standpoint, applying that in an online space, and really helped me just kind of unlock. Ended up using that for my PhD work, and then immediately said, this shouldn't be just kept to higher ed. And so, yeah, then eventually, pretty shortly after that, started Feedback as a company to do exactly that technique, and been at that for 15 years now. And yeah, it's been a great run for still doing it with higher education, but then also with healthcare and lots of other industries, including the work we do for the military. So it's been a wild road to get there, but it really all stems from really wanting to take what people do seriously, whether that's offline or online.
So I'm still trying to wrap my head around that. So would you say that it's research, and then
Absolutely,
you
yeah.
extrapolate what your findings are to make it useful data?
Absolutely. So basically, it is a research technique, and we're really focused on using this one technique, which is, observing how people interact online in public spaces. And you might immediately think, okay, well, that means, how people might celebrate a birthday, or whatever on Facebook or whatever the case may be. But and it may include what we might do in those big channels, but it also means looking at some of the more discrete channels. So, could be the, breastcancer.org, right? Where women are sharing their whole journeys, and talking about what it's like, different kind of medications, what kind of emotional support they need. So we're looking anywhere that people are talking about their journeys, be that healthcare, be that military quality of life, be that, decision-making for what college they go to. So we're, really looking at those journeys and trying to take what questions they're asking, the answers they're giving, the communities that they have online, taking that seriously and pulling that into research that can help make much better decisions and much more informed decisions versus, say, what might typically be done, which may be a survey that's real hard to even get enough respondents for. You may only do it once a year, but the idea of let's take what people are actually talking about, and the struggles that they're really having, and use that as research data to make better decisions. And again, it all stemmed from that frustration in trying to help higher education attract and retain those millennials back in the day, and realizing, hey, we're missing out on all this great behavior. People are telling us what their problems are. They're telling us their issues. Why aren't we listening? Why are we just hoping that one or two of them puts it on the answer in a survey? And, so for us, it was about really creating a better research technique that can be applied.
Yeah. So it's really just identifying the real true needs of communities.
1,000%. Exactly. Yeah. What makes even about the communities themselves and about the individuals in those communities, for sure.
Mm-hmm. So can I just ask, what does biofeedback do?
Yeah. So feedback, what we do is basically package up that data. So for example, we use anthropologists, we use a PhD level anthropologist as basically a chief behavioral officer for all of our clients, so we're taking a look at, let's say, a particular issue, and we're not only looking at what's happening right now, but we're tracking it over time and then reporting in and saying, visualizing it, being really communicating what we're finding to say, hey, here's what people are doing. Here's the trends that we're seeing. Here's how you could react to it. And we're packaging that up and delivering that to clients literally on a daily basis, and clients all over the country and in fact even the world. And we also have anthropologists that are bilingual, so we can pull all different kinds of data from different communities in their native languages, whatever the case may be. But we can look at it on a geographic basis, a branch basis, for example. There's lots of ways we can approach a problem.
Yeah. And I just love the concept of really just identifying, like, what is the real issue? What is going on? What are the barriers? But one thing I do have to ask when I first learned about your work is how do you guys deal with like privacy issues? Or is it they're always on public forums, or what is that?
No, that's a great question. It's really important for us to outline too. So we entirely look at only public communities. So in other words, we're not pretending to be anyone. We're not to get into a private forum. We're not hacking into anything. We want to know just what's being said on the public forums. And there's two big reasons for this. Number one, it helps us understand, what does a new person, has a new problem, what do they see as their answers, on the outside, whether we're looking, it's healthcare, it could be a new patient, newly diagnosed, whether it's housing in the military, somebody that's newly PCSing, to a new location. How are they looking for answers and seeing what's publicly available, how people have that community. There's definitely been times when our clients have been able to get us access to something that might be private, but that's a special circumstance. We're looking at public only for 99% of our work. So that way it's not human subject research. We're not, as I often remark about, like Jane Goodall, right? We're just observing. We're not touching. But it's like, we just want to observe, and it's just the publicly available. And just to underline this too, I think this is a second really important point. We anonymize everything that we're looking at.
Okay.
So when we're reporting it in, we're reporting the trends we're seeing, the important things they need to know, but there is not identifiable, any identifiers that, even if they have self-identified, we're stripping that out. So it's anonymized. So it's just about the information and not about a fear of retribution or anything like that. Even though it's publicly available, we're taking that step to ensure privacy when we're sharing the data.
I love that. And I love Jane Goodall. So that's awesome.
There you go. See that? Yeah. Who doesn't love Jane? Exactly.
Great, Dean. That's awesome. Lamarque, so what about you and your career trajectory?
That's a great question. My career is a serial entrepreneur. So I've done a whole lot of different things that I won't go into. But my qualification for what I'm currently doing is really that I'm the dad. So I have a 23-year-old. I have 3 kids. I should say that. I don't want to leave the other 2 out. But my oldest daughter, who's 23, was diagnosed with severe autism at 5. And I was building a totally different company in a completely different space at that time. But that moment changed our life. I often say we were diagnosed. And what I mean is, when you have a family member diagnosed, it's not just that person, it affects the entire family unit. And so at the time I was, building a high growth company, services business that was going national. And so I just put it on the bucket list. Ashland's project, why does diagnosis suck in America? And then a question, does it? And our experience was, when she was diagnosed, we were handed a sheet of paper with autism at the top and a lot of grim stats at the bottom, and the doc just walked out of the room. And that moment really fundamentally has changed the trajectory, not only of my life as a dad, but also as an advocate and somebody who wants to see change in this space and to see families not have to struggle as much as mine did to find resources and to coordinate care. I think there's kind of a myth out there that when you're diagnosed with something that like, oh, it must be in the family and you know about it. I mean, I had no idea. Most people have no idea about the thing that they're getting diagnosed with. And so I think physicians get that wrong a lot. They assume that there's some sort of familiarity with that subject matter. But I mean, fundamentally, we knew something was wrong. I had no idea what autism was. And this paper that I was handed was not helpful. It was just a lot of grim stats. And so when I sold that business, I actually thought I was going to retire. which was a horrible idea. I bought a boat on eBay that didn't float and didn't run, and pulled up a 3-car garage and ripped it apart. And that was the moment, I think, that I figured out, gee, this is a bad idea. I might should be doing something more productive. So I went back to that bucket list. And what I actually did is thought, well, surely there's a data set out there. I've always been a nerd, and began to chase data sets. There were not compelling data sets out there. So we took 250 caregivers, all different types of diagnoses. So just because Ashlyn had autism, I didn't want to just look at autism. I wanted to find out if this was a real problem for everyone, or if we just had a bad experience. And the story I told myself is I just had a bad experience. Like, surely this doesn't happen to everyone. And I found over the years, every patient and family tells themselves something, some sort of story, to try to buffer the pain and the challenges that they're currently facing. And we went out there, and sure enough, like, it was very clear, 85% of caregivers, so parents that have children with any type of diagnosis, from food allergies all the way through, very complex needs coming out of a neonatal intensive care unit, 85% of that group described day one of diagnosis as the least helpful event on their care journey. The data points just began to add up, that it was very clear that pediatric special care was 30 years behind senior care. The industry has never been organized. And families, I describe it as, like, what is the family experience like? It's like the industry is like a fine piece of china hit with a sledgehammer. There are beautiful resources, but they're scattered absolutely everywhere, and it's very hard to find it. And as families, we are on our hands and knees crawling on the carpet trying to find these shards. And when we find one, we're like, we found one. And we're so excited we found this little fragment that is, not nearly enough resources. And then we plateau. We become codependent on that one resource for a period of time. And then we hit another crisis point, and we go look for another fragment, and then we're codependent on that for a period of time. And what it should look like is a trended line of accessing care. And so these data points began to add up, and that compelled me to do two things. One was found a nonprofit that I funded, and we literally printed a book. So it turns out that mom shops for vendors for her kiddo exactly like she shops for vendors for her wedding. So we printed, I'm not, I literally have a book over there. I should have brought it to show you, but it's really interesting. I essentially made a wedding guide for pediatric special care in Dallas. We broke every publishing metric. We could not keep it in stock. And I was pretty frustrated by that, because I wanted to expand to help other families. But the idea of the book was to empower caregivers in less than a second with every resource in a geographical area. And then I began to share this data set. So I started traveling. I call it my Al Gore impression days, where I traveled the country sharing this data set. And my last stop was Stanford, and that ended up becoming a TED Talk, that whole data set. So you can find it. I have a very screwed up name. So if you can put that into Google, you will find that TED Talk. But it's very interesting because at Stanford, they set up 2 appointments. One was Ron Johnson, who built the Apple Store, was at Apple at the time, and Milo Medine. And so, imagine walking into Cupertino Apple headquarters with this book that looks like a 1990s wedding guide. Fundamentally it was. And I shoved it across the table, and, Ron takes 2 fingers like it has cooties. He doesn't even open it. He pushes it back across the table. He's like, why are you in my office? I'm like, well, Stanford set this up. Here's my data. I just briefed it in. He thumbs through the data. He's like, this data is awesome. That book is terrifying. Shut down your nonprofit, start a tech company. And that is how CareStarter was born. Milo was a little bit nicer about the book, but the same message. He's like, look, Ron's right. Unless you want to compete with the Bible and the Watchtower on a publishing angle, you might want to do something different. And so I flew home and started CareStarter in 2013. I never intended on owning a tech company, and I definitely did not want to be in healthcare. It's a very challenging space. But if we're going to help families, patients as people is our crazy theory. If we're going to help them find and access care, I have to be in that system, and I've got to be there hopefully before day one, where we're resourcing them even before they have a critical need. So it was a whole lot of talking, but that's how I ended up here. So I think a dad is my qualification for what I'm doing today, quite frankly.
That is incredible. Oh my gosh, Lamarque. I'm so amazed by what you've been able to do. And kind of thinking back, like with your daughter's diagnosis, you said it was 2016?
No, she was diagnosed. Oh boy, now you're really going to test my brain power. 23 minus 5, Dean, is what?
I'm a qualitative researcher.
No, I'm going to say it was around 2005-ish.
2005.
Yeah.
And
it was a moment, right? It was definitely, we knew something was wrong, but you don't know what. And because she was a girl, we had tried, it took us a solid year to finally get to a diagnosis because nobody wanted to put that label on her because she was a girl. And well, autism is less prevalent in girls, right? And that was the whole theory. And finally, it's just like, look, here's the diagnostic criteria. What doesn't she meet? Like two of these? Like, what are we doing? And so that became a real discussion of like, what, we can't just keep being in no man's land. And so at that time, PDD-NOS, which is my favorite diagnosis of all time, was kind of the go-to. We don't want to put a label on you. So that stands for pervasive developmental disorder, not otherwise specified.
Wow.
How's that for a diagnosis? And that diagnosis, by the way, is really unhelpful. It is very hard to access care with that diagnosis. So it was a journey and it was a moment for sure.
Yeah. Well, and I don't think autism was as prevalent then. So you were kind of like trailblazing. Like I look at the resources we have available now, they just didn't exist back then. So,
well, not only did they not exist, but there was no insurance coverage.
Wow.
So
especially with that diagnosis. Yeah.
Ashland was $100,000 a year for a decade. And so every time we changed law, which I was very involved in here in Texas, she would be a year or two older than the law. The age we would push started like, oh, we'll cover up to 5. Oh, we'll cover up to 7. Oh, we'll cover up to 12. And every single time we pushed that, Ashland was a year older. And so, just having insurance coverage is a big deal today. It's not like that solves everything, but it's definitely helpful on the financial front to at least access some care that you're not completely paying 100% out of pocket for.
Yeah. Yeah. Well, I think so many people can relate to your story as a dad, and certainly as far as resources, and it's kind of like a diamond in the rough. They're out there, but if people don't know about them, then they can't get help. So I think it's incredible what you're doing, and just really, really grateful for all the work that you've put into that. So I kind of wanted to go into, how did you and Dean meet and kind of start working together?
All right, I get to tell this story. We'll see. We'll see if Dean agrees. So we actually met at a invitation-only conference for world changers called DENT.
Wow.
And I believe that DENT was named after a quote of, oh boy, whose quote was it?
Jobs, yeah.
Oh, Steve Jobs. Yeah, we're all trying to make a dent in the universe, right? And so I went there. I was invited by a guy named Robert Scoble, who had a kid with autism. So again, all roads lead to special care for me, especially for the last 15 years. And so, he invited me. I was like, yes, I'll definitely come. He was a Rackspace guy, so he's a kind of an evangelist for technology. And he had actually seen the wireframes of the app. I actually was on his blog when we just had wireframes. The app was not even a real thing at all. And it was an interesting interview. And that's how I got to this conference. And I met Dean and his partner, Jeff, and a whole lot of other amazing people that attend the DENT conference. And it's pretty much an unconference. It's a lot of discussion. It's a lot of hanging out. It's a lot of interpersonal connection. And that's how I met Dean. And I often say that Dean, immediately to me was obviously maybe the best nerd I've ever met, which is a massive compliment. If you don't know that, I feel like I'm a good nerd, but my nerd card is not as robust as Dean.
I've got a lot of punches on it. Yeah.
That is hilarious.
So, it's funny if you've ever, I have this theory of long-term things with long-term people. I am just not a short-term person. And when I met Dean, I knew in my gut that at some point we would be doing business together. I just didn't know how or when or what that would look like. And so that is how we met. And what is really interesting about our journey is it was about 8 years later. It was quite a few years later when we were able to get a very interesting scenario where we were trying to push on the EFMP, Exceptional Family Member Program. We had gotten a phase 1 from AFWorks, and we had just filed a phase 2, and we were waiting for a contract to be inked. And I got a text message from Chuck Milam, who used to be at the Pentagon. And he's like, hey, you're on C-SPAN. And I'm like, no, I'm not on C-SPAN. I'm in San Antonio eating enchiladas. I'm definitely not on C-SPAN. He's like, no, you are. I just sent you a link. You might want to click on it. I click on it. And here's the Air Force in front of HASC, House Armed Services Committee, for the EF&P hearings, saying that CareStarter is the potential solution to the Exceptional Family Member Program.
Wow.
And then, of course, describing my company in the worst possible way. So, like if you've ever had a customer describe a technology platform, it's a little daunting. And so Chuck, I call Chuck back and he's like, hey, do you remember the promise you made to yourself when you shut down the nonprofit? And I'm like, the one where I never brief another politician? And he's like, yep, that one. You're about to break it. I need you to book a trip to DC. And so I'm coming all the way around to how we reconnected. I go to DC. Congress hands me a multi-million-dollar stack of data, RAND reports, GAO reports, surveys out the wazoo, all that say the program is broken, but not why. And if you don't understand why, then you cannot solve the problem. I mean, I'm telling you right now, like saying something's broken is the easy part. To solve it, you have to actually understand the behavior in and around the program. And so I called Dean this many years later, and I'm like, Dean, I am super screwed. I have an opportunity. I have a pilot to solve a problem that I really care about. This is why I built CareStarter. I really want to solve this problem. And this data set that Congress just gave me is not helpful. And I need you to do three things for me. I need you to take a lens of internal stakeholders. So think about not being at the Pentagon and not having a military background or a program background for this program. Looking at the Pentagon's like staring into a black hole. Like, I don't know what's in there, right? And so I said, Dean, I need you to look at command, Pentagon, all the way down to E1. I need to understand how they think, act, feel, and behave around the EF&P program. I need an external lens of families, the members themselves. How do they think, act, feel, and behave around the program? And then the last lens was landscape. Providers outside the fence. Do they want to serve the military? If they do they take TRICARE? If they take TRICARE, what are their top 5 complaints? When I got that data set back, by the time I finished reading it, I looked at my COO and I said, we're buying this company. And he looked at me and he said, I'm sorry, Lamarque, did we raise more money than I know about? Because I'm pretty sure we didn't equate that when we raised money. And I said, it doesn't matter. I am never touching another project again without this data. And so the way I would frame up feedback is they help leaders make exponentially better decisions faster, knowing that there's going to be a positive outcome if you follow that recipe. And what we did is we synthesized that behavior. It gave us 5 KPIs for the pilot. And think of that as the first layer of the onion, right? And Congress asked me, can this program actually work? And I said, I don't know. But once we had that data, we knew the 5 things that had to happen for it to have the potential of working. And that is how we stood up Travis Air Force Base as the first base in the history of the military ever to comply with the federal law of EF&P. That was it. We just followed the plan. So we knew we were going to win before the gate. And listen, now we have a second and third layer of that onion that we're ready to get after, right? But now we at least know that value can be delivered to the family. So that's how not only did we meet, but how do we reconnect and become collaborators? And it's 3 years ago this month, I believe, Dean, that we closed the deal. And so I get to live my dream of working with an amazing team, but working with feedback and getting to work side by side with Dean and Anna and the rest of the feedback team is an absolute privilege and joy. And I feel like I'm living in a dream pretty much every day, like working with people who really want to change things, who really want to understand humans as people, right? And really want to help people have a better experience. And to help leaders and policy be better. So that was a lot more than you asked for, but that is not only how we met, but how we ended up collaborating. And it's hard for me to imagine not waking up in the morning and working with this team because they are absolutely stellar and committed to better data leads to better decisions.
Yeah.
Wow, what a journey. So Dean, I have to ask you, when you heard from Lamarque, totally out of the blue, what were you doing and what were you thinking when he's inviting you to do this work with him?
Yeah, what's even funnier is I can't remember if we've actually even talked about this, Lamarque, but I was speaking at the Craft Brewers Conference, the national like I think it was in Philly, like on the Market Street, like right after having just walked off the stage, I think when you initially called. But no, it's perfect because what Lamarque says. I mean, their real focus was that patients are people, and we had at that point. I mean, this 3 years ago, we'd already been at it for over a decade, trying to make providers and medical device and pharma and everybody else we've ever worked with understand that as well, and really understand the issues and things like that around. So for us, it's an absolutely, perfect marriage for us, because it really is about, I think if there's anything that is the most frustrating for any research company, it's to discover problems and watch people not fix them.
Wow.
It's to show them, here's where somebody's having a real tough time, and watch someone ignore data. And so to be able to be paired with a solution is a dream for us, right? I mean, because for us, we can say, look, help us, operationalize our data, in an even bigger way. And they've helped teach us how to do it, even in industries CareStarter doesn't work on. So just to say, I mean, we still work even in a lot of other areas that CareStarter may not touch right now. But it's been great, really motivating for us to work with, even better partners to hone what we do with the data, to deliver it in ways that are even more impactful. And so it's really been tremendous for us. And, it's a part of our own stories, or our own care stories, whether it's my daughter Addie, who was diagnosed with an incredibly rare tumor. Thankfully, it's out. It'll be back because it's a genetic one. But that was literally happening 3 years ago when we were being bought by CareStarter. And so it was a great testament, too, to what we are doing for families every day on the healthcare side. Here I'm going through it, with my own caregiver. But then on top of that, then to pair with a company that has that same level of dedication to family and providing care and accurate care that actually helps, it's a true dream on our side too.
Wow. Well, I have this firm belief that when your intentions are good, the stars will align. And I really feel like that's the case with this partnership. And what an amazing story. I have to say, prior to this interview, I had seen an article on NPR that read half of the U.S. military bases nationwide are in healthcare deserts. And it immediately made me think of CareStarter and what the work that you guys are doing. So kind of diving into that space, can you tell us about the Travis study and how did that come about?
So, okay, so we'll get to the desert thing. Don't let me forget to come back to that at the end.
I won't.
So obviously, geography plays a huge role in healthcare, where you're located. We've done a lot in rural healthcare. And so first of all, let's frame up kind of what CareStarter is and what we do. Think of CareStarter as like a super freeway, a super highway for information. A lot of care companies that we see right now, and a lot of the really popular ones, are essentially they're sending you to a website to try to find resources. Okay. And I can tell you that's not good enough. I'm not saying it never works. I'm just saying it's not good enough. Caregivers have a big challenge. And I have a lot of experience, in 2021, when we came to the EFMP thing and actually had a chance to do it. I had all this history with civilian caregivers. And I tell you right now, and when I say caregiver, I'm talking about the parents, right? The families, the husbands, right? The wives, the spouses. I had all this history, but if I told that group, I tell you what, I want you to coordinate care. So it's hard enough if you move on average every 8 years or 6 to 8 years, right? It's hard enough to coordinate care. If I told those moms that, I tell you what, I want you to coordinate care and I want you to move every 2 years, I would have no teeth in my mouth for sure. Okay. And I might be, completely disfigured because that would not go over well. And that is exactly what we're asking our military families to do. Not only to serve our country and raise a family in the process, but we are moving you geographically on average every 2 years for the Air Force. And so imagine the challenge of that, right? And so you're constantly starting over on your care journey. You're starting from zero. And so when we got to Travis, we had a whole bunch of questions. First of all, the data set was super clear. We synthesized all three of those stakeholders, and this is what they were saying. Number one, do the providers exist? If so, how far are they from base? Do they take TRICARE, and what does the waiting list look like? Those were the top 4 questions. And then the 5th one was pretty shocking to us, and I didn't know much about it, which is that nobody really trusts travel recommendations. And that really we needed to do a better job of making those. And so we learned a whole lot about how the Air Force was doing that. And they are definitely making strides on innovation. So I will say this, it's our pleasure now to be working directly with AFPC and our TACFI contract, which is HR for the Air Force. And so we've learned a lot more. But at the time, we were just looking at what was happening at Travis. And we said, okay, great. Well, you're supposed to be delivering, resources to families. And it turns out they were getting to 0.5%. And that is true across the Air Force. 0.5% of families are actually getting any sort of resource from the exceptional family member program. And the other services aren't doing much better. Okay, so that's not unique to the Air Force. I'm just saying that this has been a failed program pretty much from the inception. And so when you look at that, you're like, okay, well, this is a problem. And what Dean's data so accurately pointed to is that fundamentally this program scores less than 0 for the member. There is not value delivered to the member. And this happens a lot in all types of government healthcare, because what happens is compliance ends up being paperwork. So there's all this extra paperwork when you're EFMP. You have all these extra hoops to jump through in an already stressful time when you're PCSing or moving to your next base. And at the end of all of that pain, there is not value delivered. In fact, the number one sentiment that Dean and his team found was that you have to be your own case manager. That is the number one thing. When you're Q-coded and you go to the internet, the first thing you're going to learn is you better not expect anything of value from this program. You have to do it. And when you look at that sentiment has been shared 1.2 million times in the last decade. It is the most prevalent thing. And if that doesn't say where the program is, I don't think anything does. And so we knew we had our work cut out for us. So we're like, okay, we get that value is not being delivered, but when you make these decisions, what are you looking at? Now, we call that a network of care, okay? So when you're talking this NPR story that's talking about healthcare deserts, keep in mind that our theory is patients are people. So we go way beyond healthcare, all right? So healthcare is about 20% of what patients need. I want you to just think about that for a second. 80%, so another way of saying that is health is not found in the hospital. It's found in the community. And so if we're going to help these families, we need to connect them not only to the best medical and therapy, but we need to connect them to educational resources, right? We need to connect them to nutritional resources. We need to connect that entire family unit to family resources, which is the largest area of our database. And then my personal favorite is recreational resources. So just because we have a kiddo who's in a wheelchair with a trach, right, an event and a G button, they're still a kid. And so it's our job to show them resources that are camp that they can go to, horse riding, parks that are accessible, theme parks, right? All the things that normal patients as people do, we want to wrap that entire care bubble around it. Now, we call that a care map. But when we looked at the network of care, at that time, they had 140 providers on a spreadsheet that they were looking at to make a decision. Almost all of those providers were medical and therapy. And what we do in the civilian world and now in the military world is when we engage with a client, we understand their network first. What does your network look like? They usually understand their network, not always. And sometimes that network's not been vetted recently, but they at least understand that. And then what we do is we build a network of care. Everything that patients as people need, we will go find and vet those resources, and we put them in a database and we keep them vetted. So this is a constant game. Think of like a basketball game or a football game where you're putting players in and out. That is what's happening. And so what our system does, once we understood the total network of care, and at Travis, that was a 1,600% increase in potential providers that could be delivered to families. 1,600%. Okay, so just soak that in. And there's a really cool map slide that we have that kind of shows this that I love. But to your point, even if I drop you in the middle of the best network of care ever, but you can't see the care and find the care, is that helpful? Mm-hmm. And the answer is no. If I drop a hungry person into a community with a whole bunch of food, but they don't know how to get to that food, is that helpful? No, it's not. And so what our system does is takes that entire network of care, and then it takes the patient profile, age, diagnosis, zip code, payer. So the diagnosis is how many comorbidities do you have? What are the medical and therapy that you need? That goes on the map first, the care map. So when we get that profile, our algorithm builds a care map that is unique, one-to-one matching to that patient profile. Here are the resources you need, because what I don't want is to send every resource to a family, right? Because then they have to comb through and find it. So a care map is specific resources for your EF&P member, whether that's your spouse or a dependent, and it is a 18 to 24 month care map. In other words, it is built not to be accessed in 1 week, but to access over time. And that's what we want to see, is persistent resource access. And so our system literally would build that care map and then deploy it to email and mobile phone, right? So you're getting a text message saying, hey, you've gotten a care map, and an email saying you've gotten a care map for this gaining base. So you've gotten an EF&P care map for Travis. And we were able to move the needle on delivery of value. So that's the value that families need, first of all, is that care map. And we were able to move Travis from 0.5% to 100% of inbound families getting a customized care map on their mobile device and email 3 to 6 months before they PCS. And that is where our journey is started. We are now have a full roadmap to go way, way, way past that. But if we couldn't do that, then there's no point in moving forward. And that's what we proved out at Travis, that this program can deliver meaningful, customized care that is accessible to an individual member in a meaningful way every single time they PCS. And I actually think now that we can go way past that. But that was a lot of talking, but that's the fundamental theory of what we've done at Travis and what patients as people need. EF&P members deserve true accessible resources and a care map that is unique to them, not a, hey, go to Google. My favorite comment that is sarcastic, very much, it's not my favorite comment. Sometimes I have to not respond to this, is, hey, families have fingers, they can just Google. Mm-hmm. If that were true, I can promise you, I would not have spent the last 15 years doing what I've done. If I really believed that that was a true statement, I certainly wouldn't be, wasting my time on this. So with that, I'll kind of wrap up. But that network of care, understanding not just what providers are there, but are they accessible? That is the real meat and potatoes. So if you compared our database to TRICARE's at Travis, ours is 2/3 larger. So 80% of my database, the military and TRICARE doesn't pay for. They are cheap, free, or scholarship resources that are around families, right, to connect them and interconnect them, not just to base resources, but to the community themselves. And that's where we find health and resilience and readiness, is when we have full support for families, a bubble of support wrapped around them versus a couple of resources here and there. And we're holding on to those resources for dear life.
Yeah.
Just if I could just kind of, as like a, kind of close that up too, to be able to say that the idea that there's these healthcare deserts, what kind of gets me sometimes is, yes, that news story is absolutely important. That's only news to us on the outside. It's already very apparent, and it's talked about by these families about the deserts. And when it's not a desert, it's a maze. And that's the problem, is that even in some of these cases, that's the beauty, I think, of what, this bubble and what the care maps can do, is that it's also in many ways connecting to things that are already paid for, incredibly successful programs once they can get people in the door. But I think what we're finding is an incredibly aware group, an incredibly aware set of audiences. And this is true even outside of the military, with people being very aware of the state of healthcare right now. Mm-hmm. That also is only more compounded as you deal with comorbidities, complex needs, and you just get further and further pushed down, both just in terms of what you deal with every day and the amount of time you have to spend on your phone. That's the other reason why that Google, comment is so infuriating, right? It's because, if that was only the thing you had to do, as opposed to spend 8 hours a day on the phone arranging care for your kid, which therefore also affects spouse employment. It affects what you can afford from a housing perspective, and then how far you are away from childcare. It affects all these other elements of your quality of life as a family, as a military family. And so that's what's so fantastic about it. I love even just the name of it as being a map, right? Because part of this is, how do you even just get through the maze that you're handed? And that's assuming that there even are things near you that, to be able to take advantage of.
Yeah. And I will just say this about rural healthcare, which is what that's referring to. This is why internet access is so important across America, because what happens in a rural setting, that care map is still delivered, but it is more regional and more virtual as opposed to physical resources. In other words, you may only have a few resources. Clovis, Cannon Air Force Base in Clovis, New Mexico is a great example, because I used to live there when I was 19 for some reason, bought a house there. And what was interesting about that, if you think about Clovis, you can't just ramp up a database for Clovis. You have to ramp up an entire region. Amarillo, Lubbock has to be a regional database, and then you have to supplement that. And so the algorithm works the same, but the way it works in this situation is base resources first, then local, and then if we still have gaps, it's going to go a step further, then regional. Okay, mm-hmm. So it's going to look at that broader regional of Lubbock and Amarillo. Are those resources there? And then let's just say there's not a support group. It's going to go national. Is there a virtual support group? So it will go find a virtual support group in our database and put that on the care map. And so the care is still available, but in a different way. And that doesn't always work. And certainly CareStarter cannot magically create resources in a market where they aren't there. But I do believe, and we want to prove out over the next several years, that if given the contract that we would like with a lane to recruit to the network, I believe we can bring providers into those spaces that would happily meet those needs. There are some policy changes that need to happen along that space. So this is a long game. This is not something you can snap your fingers and magically do. But what we hope to prove over time is, look, with the right policy decisions and changes, and the right lane of recruitment and a fast pass to get folks into the network, I can solve some of these because we have great relationships with people who really do want to serve the military and to serve this population. And so it's not that, I would say the same thing about the staff, the Air Force staff for EF&P. This is not a people problem. They don't have the right tools to solve the problem. They're amazing people, amazing case managers in this program that are literally feeling defeated every day because they don't have the right tools to get the job done for families. It's not that they don't care. It's that they just can't get. You have a 1 to 600 ratio. For every one case manager, you have 600 families. That's not going to work out because health plans are not being successful with 1 to 300. Right. And so we knew that from the get-go, from those GAO reports, that's not going to work out unless we have a tool that scales that case manager across way more lives and helps those families access care.
I wish we were more passionate about this.
Really.
Bad that.
I love it. And I'm really overwhelmed. I just think this is incredible what you guys are doing. And one thing that really kind of popped out at me is just holistic care, because you're saying 20% is healthcare, 80% is other resources that the families need to support them, and including recreation and just putting a smile on their face. And that's just really incredible. And you did answer one question that I had was, how are you finding these resources? And I think that's incredible, how you're finding them. And now even thinking maybe we can start creating our own resources or help improve resources. So that's incredible. So as far as adding value to this, I'm just kind of thinking of so you give a family a care map and they get it on their phone. Is there somebody that helps them guide them through it if they have questions? Is there a customer service portion of that helps the families navigate it? Or?
That's a great question. So multi-pronged answer here. Okay. So number one, currently we're wrapping up a TACFI contract, and that is an R&D contract. And R&D contracts are really focused on two things. Number one is customization. It's called dual use technology. So customizing CareStarter's platform for the EFMP use case. That is now an entire roadmap, some that has been built, a new system that's just launching, and a whole long roadmap of where we want to go with it. That's part of it. And then the second piece, as far as the program, it is really only built to show compliance. Can we actually deliver a care map? Think of that as like step one. I have to be careful here because we're in the process of negotiating with stakeholders at the Pentagon, as well as AFPC and elsewhere, about our next contracts and what those look like. And we would like to see a purple demonstration for all branches. And we would like a more robust contract. So currently we can't contact families. All we can do is deploy a care map to those families. Now we hope to do two things. Number one, we would love to make this way more robust. And I think we're working with stakeholders at the Pentagon, specifically at the Air Force, to talk about how we can really push that ball forward and what a full expansion looks like. And so that's exciting to me, but that's about all I can say about that. I can't go into much more detail. So it's interesting. So think of what we've done so far is just like the most basic thing. Can the program and can CareStarter's technology be adapted? And does that adaptation show that the program could be compliant if applied across the board? And I think we've shown that with a resounding yes. And so now it comes down to my favorite question, which is how far can we go? How much delay can we extinguish for families? How much can we improve access to care? And that's really an adoption roadmap. And we need a different contract to really push on all of those things. And that's what we're pushing for now. I will say this, why should somebody on your podcast that maybe is not involved in EFMP or doesn't know what the program is, why should they care? And here's why. Dean and his team just did an awesome study in partnership with the Association of Defense Communities and Five and Thrive, which Five and Thrive was founded by Miss Brown, Chairman Brown's spouse. And it started in the Air Force, and now it's going purple and kind of getting peeled out as his own nonprofit, and is also co-founded by Leslie and Marion. And I got to tell you, this team, we met them, and I loved their framework. They have a quality of life framework that I found just beautiful and very, very relevant. And so we used their framework in an indicative study to look at quality of life for the total force. And what is fascinating is, and keep in mind, I'm not the researcher, okay? I get briefed just like everybody else, okay? So I'm along for the ride with you as Dean and his team uncover these things. But the number two macro takeaway, the big takeaway, was that EFMP is the canary in the coal mine for the total force. In other words, EFMP is the leading predictor of quality of life challenges for the rest of the military. And the reason that is, as I was getting briefed and talking to our PhDs about it, is because this family, they're high utilizers. So they're hitting every single barrier you can hit in a very compressed time frame. Example would be, we are not helping EFMP families access respite care. We are failing in that. And until we can fix that and figure that out, there's no way that we solve child care for the total force. If we can't deliver respite care to a small population, what makes us think that we can solve child care for the total force? Another example, spouse employment. The minute your kiddo, and the kiddos in this program, so the Air Force is at a 9% rate of EFMP. So 9% of the force is in this program, which means a large part of this population is hiding from the program, because I can break that stat with 2 diagnoses, okay? But the people in the program are the people that can't hide. They're in wheelchairs. They have Down syndrome. They have severe autism. Like, they can't hide. It's obvious to everyone that they need to be in this program. And what is interesting when you look at that is to watch the minute you get a significant diagnosis, spousal employment, you're a one-income household, right? If you can't access respite care and you aren't getting in-home care, how is a spouse supposed to go to work every day, right? And so those are just 2 small examples of how EFMP really needs to be front and center on the quality of life debate and discussion. Because until we get after that, we're not going to understand the bigger solutions for the total force. I feel like I just nerded out hardcore. I'm sorry.
Yeah, that was so So good and so exciting because, it really is about readiness, and it's like we're asking our soldiers to protect our country, to deploy all the time. And especially in the EOD community, the job is extremely challenging. And you're so right. It's not just a soldier, it's the entire family. And I love that. And it's so important. Another thing that, kind of came to my mind is just talking about healthcare and how kind of fractured it is and fragmented. And it's like, yeah, you can tell them to, Google, find resources for yourself, or even, I just look at healthcare as a whole. We have all these different disciplines within healthcare, and it's just difficult for people to navigate itself, not let alone all of the other things that go into being a family. So I am just thrilled for this program to hear that you guys are making these major strides in helping improve the quality of life of our soldiers. So I guess if anyone is listening and stationed at Travis Air Force Base, and maybe they're one of the families that you mentioned that are hiding, how could they possibly reach out and get involved?
So right now, the pipeline is through the MTF and the medical case managers at the MTF that are assigned to EF&P. So right now they're using a form-based system to tell us, hey, this person needs a care map. They're green, they're cleared hot. So the inbound is the pipeline. If you're at Travis right now and you are already there in EF&P and you have no idea what we're talking about, we just keep in mind one of the interesting things about government contracts is that certain things can happen to pause contracts. And we had the fortune of getting audited. AFRL got audited for HSR, Human Subject Matter Research. We were one of the larger contracts, which means we got audited. That means that I had to pause all services.
Yeah.
I had to pause all briefings. I had to pause all care maps. And so I'm 100% sure that there are families at Travis that maybe haven't received a care map because they came in during that pause. Mm-hmm. And so they can contact EF&P, either family support, which is, I think, in the Personnel and Readiness Center, and then, or you can go to and contact the medical case managers inside the MTF, which is the hospital. So you can go there and they will actually deploy a care map to you. It is a very simple process. It takes a few minutes. And what we're building and working towards on the next contract is to fully automate care map deployments. And the reason is we want to lift that burden off of those care managers. And we would actually like case managers to spend more time doing what you said earlier, being able to reach out to families and say, hey, did you get a care map? Do you have any questions? Is there anything that you need that's not on that care map? So we're not trying to in any way extinguish case managers. We're actually trying to give them time back so that they go extra steps down this care journey, which again, Dean's data points so clearly that is what families need. They need more help. They need a higher touch. They need white glove service. And right now, the whole process of PCSing and moving and travel determinations is eating up the bandwidth of case management, so to where they're focused more on that than actually spending time with families. And so we want to see more of that and to see that happen. And so that's how that can happen. And then I would say, I also know that we just opened up care maps at Travis to all airmen. And so what that means is that anybody at Travis, even if you're outside of EF&P, you can request a care map. And I believe that I'm going to get myself in trouble here because my director of delivery is not here, but I believe that if you go to our website and go to the Travis landing page, it will tell you how to do that. And if not, Jessica Holter's information is there. Kat Williams's information is there. You can reach out directly to them and say, hey, I'm looking for that. The other thing I would say is if you're not at Travis and you're listening to this and you're bummed out or you're excited, either way, about what you're hearing, look, we need a lot of support. If you've ever been a small business trying to engage the Pentagon and Congress to get a ball moving on a transformation of a program, I can just tell you it's not for the faint of heart. And we have had a great fortune of having amazing stakeholders, including congressional stakeholders, coming along beside us and supporting this and saying, look, you've done the work. Now let's see if we can expand it. And I cannot stress enough. So again, the Air Force has this now. We would love to serve the Army. We would love to serve the Marines, the Navy. And of course, by default, right now, we're serving Space Force, but we'd like to be more intentional about that. And so any support on that effort really matters to a small company like ours that is trying to do new things and better things for families to ensure that they are accessing care. So that was more than you asked for once again, but that's the playbook for sure.
Wow. I just think the scope of this is enormous. And it's like, I want everyone to have a care map. It's like, I know we're focusing on the military and we love our military community. But yeah, it's just, I think this is the beginning of something wonderful. And having been in healthcare myself for 10 years, this really gives me hope because, I've seen kind of just how fragmented it has been. And I think a holistic approach is so important. I think, it takes a village. So all of us coming together, and it really just makes you realize how interconnected we all are. So thank you, Lamarque, so much, and Dean, for sharing this exciting project with us. We definitely wish you the very best. And anybody listening out there who wants to support, please reach out to Lamarque and Dean and see how you can help. And to any families out in Travis, I hope you'll reach out and try to get access to this program. And just thank you guys for everything that you're doing.
Absolutely. And I would just say for the nerds listening in, if you want to see that data set that we did for the Association of Defense Communities and in partnership with Five and Thrive, it is publicly available. If you go to our website, you can click on the landing page for that, and you'll see the quality of life study. Click on that, and you'll see a 2-hour webinar of Dean presenting the data. So it's a long
Nice.
It's a lot of data, right? When you think about these data sets that Dean does, the easiest way to explain it is it's 10 to 100x more data than a survey in 8 weeks.
Wow.
Okay, so it's just the speed and the volume of goodness that you're getting as a leader is really impactful. And we did this with the Association of Defense Communities, which is a great team. And we did it with the agreement was, hey, we want this released publicly and we want it briefed constantly. And a lot of what we're trying to do as we grow is make sure we're giving back to the community in a way that can become a beachhead of data for other projects that are quality of life. So in no way do we think, we're not trying to solve everything. We're actually trying to give folks a beachhead of data where they can gather. If you're doing something awesome and you're working on quality of life in this space, like we want that data to live there. We want to collaborate with you. And so I just wanted to point that out for your other listeners that might be a little nerdy like Dean and myself and want to go all the way down the rabbit hole of what that data set says and what that looks like.
Awesome. Well, so what is the website, Lamarque?
So CareStarter.co is the website, so .co. That's an easy one. And then Feedback has a lot of other content, blogs and such, and that's discoverfeedback.com. And so those are the two URLs. And again, a lot of people say, well, Lamarque, why do you have separate brands? And Dean touched on this earlier. CareStarter is very focused on health and human performance. And so we're very focused in that space, but feedback literally can be applied anywhere there's humans. If there's human behavior, you should have feedback riding sidecar with you as a leader. And so that's why the two separate brands is feedback goes places that we don't intend on going. And so, definitely check those two things out. There's a ton of value there. And certainly we'd love to collaborate with folks that are doing good work. And so if you're doing good work and you want to chat, please reach out to us. We'd love to connect.
I love that. That leads me to one more question. So I know you guys have been focusing heavily on Travis Air Force Base and the resources in that area. Are there any other areas in the nation that you have kind of started peeking at maybe as far as resources, or is it strictly Texas?
So we're in 6 of the top 20 markets, but very quietly, okay, with other customers. So we're serving that customer base. We don't have a big public facing, hey, you can do X, Y, and Z on the app. I will also say we're launching brand new technology. We launched a brand new platform. So the app that's on the store is about to come down, and all of that is going to start getting rebooted in the new platform, which is exponentially better than our old platform. So there's a lot of good things coming on that. So stay tuned. And then as far as military expansion, we are having those conversations. Again, I have to be very careful what we're saying. Mission number one right now is to make sure that Travis gets sustained, that the platform there at Travis, that's mission number one, is get that sustained as our contract's up at the 15th of next month. So we're eagerly waiting that news. And Travis and Air Mobility Command, I'm sure they are doing great things there to make that happen. But beyond that, we'd like to see expansion. Again, we'd like to see a purple demonstration. We'd like to see all branches and really show, their services often like to say, and this is true, that they're very different, right? And they do talent management very different. But I like to remind them that your families are not different.
Wow.
Your Marine families that are in EF&P have the same needs as the Air Force. Yes, there's different deployment op tempo. Yes, there's different. I get that. I'm not saying the services are the same, but I'm saying the families that are people, right, in a family unit, they have the same needs. There is nothing different, and value is not being delivered to them. And we want to help you increase that value. So we're working on all those fronts, and hopefully we get to come back in a year and have a lot more to share with you and keep you up to speed on, how we're creating value for families and helping them access care.
That was so exciting. And it's funny that you mentioned all 4 branches, because EOD is actually unique in the fact that it's the only career field in the military that it's the same badge for all 4 branches of service. And they all go through the same school that's here in Niceville. So yeah, you're right. They're all unique in their own way, but certainly their families are the same, and we're all people, right?
That's it.
Yeah,
100%.
so great. Yeah, let's circle back up in a year and see how far you guys have come. I'm very excited for this, and I love your passion and enthusiasm in helping the military families. So thank you.
Thank you for having us on. It's a pleasure. And thank you to your audience for watching and letting us nerd out a little bit. Dean and I appreciate it.
Yeah. Cool. Well, so we're going to end the interview, as is our tradition, in asking you guys a couple of your favorite things. So the first one is, what is your favorite kind of music and or band?
Oh, man. Did you know that Dean and I are music nerds?
No.
I'll keep this short and just say, yeah. Favorite band ever is 9 Inch Nails.
Wow.
All
Good
over
band.
music, though. I mean, I truly, so.
Oh, you're going to stop there? Wow.
Because otherwise we'll be here for another hour.
Yeah, that's true. So a couple of things. Number one, I mentioned my dad's a minister, which means that everybody I knew growing up made a record in the 70s. And so to my right, that you can't see over here, is a massive Christian album collection of over 300 albums. Most of people I know, like my dad's albums, are over there, even the ones he didn't tell me he made.
Wow.
Grandparents, it's pretty awesome. So that's a fun thing on the music side. And then, of course, I live in Austin. And it would be impossible for me to say my favorite thing, but I can tell you this: Austin artists are my favorite. Hearing a band that hasn't blown up yet in a room of 20, 30 people is absolutely amazing. The talent is a beautiful thing. But tonight, I will be going hear one of my favorite artists, which is Walt Wilkins. And if you have not heard his music, you should look him up on Spotify. He is an absolutely, I would frame him up as singer-songwriter and one of the best Austin hippies I've ever known. And he is a genuinely amazing human. And bonus, his wife is also a musician and a special ed teacher. And so, again, love those people. Again, I love people. I love music. And so that's what I'll be doing tonight. So that's the shortest answer I can give.
That is awesome. Well, I'm totally going to look up Walt Wilkins. I've not heard of him. So thank you for that.
Yes, absolutely. That is my therapy. Running companies is not exactly for the faint of heart. And when I have a day that I'm like, oof, man, going in here, a little bit of music puts me right back into center, right? It's a great thing. So if you come to Austin, make sure you go hear shows not on 6th Street, not just on 6th Street. Find another venue. Find a Saxon Pub is a great one. Find some amazing talent when you're here.
That is awesome. Lamarque, I have to share this story with you really quickly. I have been to Austin, Texas one time. When I was in the Air Force Reserves, I worked with a lady who was obsessed with Russell Crowe. And one day she's like, hey, Russell Crowe is playing in Austin this Friday. And tickets are sold out, but the first people to the venue that morning, the first 100 people will get a ticket. She's like, you want to go? And I'm like, yeah. So we drive all the way from Florida to Austin, not having tickets at all. And we got there like really early in the morning. I can't remember what time, but it was super early. And there were already like women that had lined up and had camped overnight to make sure that they were like the first 100 to get a ticket. And I don't know how we managed, but we got a ticket, and I got to see Russell Crowe play. And there were rumors that Sandra Bullock was attending the concert, and it was incredible. So I love Austin.
Yes, Austin is my favorite place I've ever lived. And a lot of people complain about the traffic and this and that. And I got to tell you, the music scene is absolutely amazing. It really is.
So cool. So cool.
Don't miss the music if you come to Austin. That's my advice.
Dean, have you gone to Austin to visit Lamarque and listen to music?
Oh, yeah, many times before I knew Lamarque and after. Yeah, but I love Austin. There's really no comparable city in that way.
Okay, cool. I hate to go off on a tangent, but what about comparing Nashville to Austin? Like,
I can totally take this one. Dean, I want to hear your opinion
on this.
Yeah, so I went to Nashville last year, and I was just bitterly disappointed. And it's not from the talent. The talent was amazing, but I have never tipped so much money to musicians to say, please, dear God, don't play another cover. Play anything that you care about, anything that you've written that we don't know. And in Nashville, because it's kind of a commercialized industry there, they're playing all these covers, and technically the bands are amazing, lots of talent. But you really have to, go to Bluebird, get outside of town to hear what you hear in Austin, which is maybe one cover per set and everything else is original. That's the difference between Austin and Nashville. Is Austin, you're going to hear a lot more original music that they really care about, and maybe a cover here and there. Now that does not hold up, and I need to say this, on 6th Street as much as it does in the rest of Austin. Okay. So in 6th Street, it's a little more commercialized. It's a little more covers, but you're still going to hear a lot of original music on 6th Street, and you get off 6th Street and that's pretty much all you're going to hear. So definitely that's my 2 cents. Dean, what is your observation?
Yeah, I'd say the same thing. I mean, I'd say Nashville has that issue. I think it's taken over a lot of the town, right? Yeah. Is that kind of commercialization. But you get a little bit outside, it can be amazing. A good buddy of mine owns the combo record store, pub, and music venue called Vinyl Tap. And it's just outside of Nashville. A lot of artists live around that area. You'll hear great stuff there, but it's certainly not the stuff you're going to hear just around the hotels, downtown. So, yeah.
How cool. Well, I had no idea you guys were such music buffs, but I'm glad I asked.
Yeah, seriously, you pulled on a good string there.
Yeah, we just upset everybody from Nashville, probably. I'm sorry.
Letters you make.
If you know of better venues, please send them to me on LinkedIn / I'm easy to find. Just find me and correct me. I will. We
need to do a care map for music.
Oh, that would be good. Don't give me ideas like that, because wait a second, we can do that.
I love it. Okay, on to the next one. What is your favorite type of food?
Soul food for me, like Southern soul food. Like, give me black eyed peas, collard greens.
Yum.
Yeah, that's my love language.
Yeah. Boy, this is a hard one too. I do love food. I would say Cajun food for sure. Dean and I vibe a little bit on this, like soul food for sure. But Cajun food, that's my true love. Crawfish season is about to end. I'm very sad. But the Cajun food is for sure my favorite. But Tex-Mex is amazing in Austin. It's if you're from New Mexico, it's different. I know that's a different vibe, right? But love that. Love Cajun food anytime, anywhere. Spicier the better.
Right on. Okay, what is your favorite vacation spot?
Oh, vacation. That's a hard one.
Yeah.
What's vacation?
If you have time for a vacation, you guys are so busy.
I like anywhere near the water, but honestly, if I'm named my favorite ever, I'd love Sedona, Arizona. Is like my.
Oh wow.
It's like my happy place. So yeah.
Where do you go in Sedona?
Anywhere.
Really? I've never been.
Airbnbs we've done,
it's beautiful.
It just kind of depends on the length of the trip, but yeah, love getting out there anywhere. Cathedral, my favorite place.
Yeah, I feel like Sedona is amazing. That's for sure. But for me, I don't really know that I have an answer for this one because I don't take a lot of time off. When I do, floating the river in Texas is probably my favorite. So I'm changing the question. Do you like how I do that? If I don't answer for your question, I just change the question.
I don't mind.
Yeah, I mean, floating the river, if you've never done that in Texas, it's a special thing. A lot of camaraderie, a lot of fun. And so, yeah.
Is there a specific river, or you can float any river?
So I float a lot of the San Marcos area, but the Guadalupe's close. There's lots of places to do it. I will float any river anytime. And the colder it is, the better. Like if it's cool water and it's spring fed, sign me up, especially in the summer. But yeah, I love that. Again, great time to hang out with people. I am a people person. Anytime I get a chance to hang out with folks and meet new folks, I'm always in.
Awesome.
That is my favorite thing to do, period.
So when you say floating the river, I'm imagining like you in an inner tube.
Absolutely. Yeah, no, none of this, rapids, class 5 rapids. I've done that. But yeah, I'm talking about like lazy river for real, like just hanging out, taking time.
So cool. Okay, so last question. What is your favorite hobby or thing to do in your spare time?
It's easy for me.
Other than floating the river.
For me,
that one.
flying airplanes, 100%. I'm a pilot. I love it. I got my ticket last year. I started flying right before Ashlyn was diagnosed. I actually was on lesson 3 or 4. Mm-hmm. And then she was diagnosed and I realized there was no health insurance coverage. And I was like, and the flying is going to stop. That killed that budget real quick. So I came back to it in the last 2 years and love it. So flying airplane.
Wow.
You know why? Because when I'm flying an airplane, guess what I'm not doing? I'm not thinking about business.
Yeah.
That's a bad idea. You should multitask and fly an airplane. That's not a good idea.
Yeah. If you ask my wife, she would tell you my hobby is collecting hobbies, which she probably not wrong technically. But no, I'd say I'm a huge, speaking of Arizona, baseball nerd, especially for Arizona Diamondbacks. So, watching the Diamondbacks, reading, hanging out with kids, that's a big one for me.
Awesome. Very cool. Well, guys, it's so nice to meet you. Like I said, I'm so excited that you're in this space working together. I expect incredible things to come through your partnership, and we'll circle back in the future and see how far we can get Care Maps.
Awesome. Well, thank you so much. It's a pleasure meeting you, and thanks to the audience for listening in. I appreciate it.
Yeah,
Thank you both. Thank you both. Take care.
Thank you for listening to our Behind the Warrior podcast, brought to you by the EOD Warrior Foundation. The EOD Warrior Foundation is a 501c3 nonprofit organization serving the EOD community by providing financial assistance, scholarships, and providing hope and wellness resources for the active duty, reserve, National Guard, retired and veteran EOD communities and their families. We also honor our fallen and wounded EOD technicians by maintaining the EOD Memorial and Remembrance Garden. We do all this through the generosity of individual and corporate donors and sponsors. If you would like to assist the foundation or support our Behind the Warrior podcast, click the link on our webpage at eodwarriorfoundation.org or contact us at info@eodwarriorfoundation.org. Thank you for listening, and don't forget to tell a friend. The various opinions, beliefs, and viewpoints expressed by guests, contributors, and participants of the Behind the Warrior podcast are their own and are intended for informational purposes only. They do not necessarily reflect the opinions, beliefs, viewpoints, or policies of the EOD Warrior Foundation or its employees and volunteers.